If your body wanted to warn you about a life-threatening disease, it wouldn't scare you. It would feel normal. Not pain, not collapse, not panic, just something easy to ignore. Sarah felt tired. Not exhausted, not sick, just tired. For 6 months she blamed stress. Her doctor agreed. Get more sleep. But the tiredness didn't leave. By the time someone finally ran the right test, Sarah's kidneys were working at 15%. The warning signs had been there the entire time. Her body had been screaming, but the screams sounded like whispers. And here's the part that should worry you. If you're watching this and nodding along, these warnings may already be happening to you. Today, I'll show you 3 real medical cases where tiny symptoms predicted massive disease. I'll reveal 5 subtle body warnings doctors say patients ignore the most. And I'll explain why the most dangerous signals your body sends almost never feel dangerous at all. Let me show you exactly how this happens. Your body is designed to survive. When something goes wrong, it doesn't panic. It adapts. It compensates. Doctors call this physiological masking. Instead of shutting down, your body reroutes. It borrows. It stretches itself thin. Imagine your heart struggling to pump blood. Instead of chest pain, your body speeds up the heart, redirects blood flow, even grows new vessels. You don't feel danger. You feel a little tired. Meanwhile, the damage continues. A cardiologist at Johns Hopkins put it this way: the human body is incredibly good at hiding its own failure. Your liver can lose 70% of its function before symptoms appear. Your kidneys can drop to 25% capacity while you feel fine. Early cancers often cause no pain at all. The most dangerous diseases don't announce themselves, they whisper. And here's what makes that terrifying. The longer something is wrong, the less likely you are to notice it, because your brain adjusts. The abnormal becomes the new normal. Research shows there's often a multi-year window where treatment would work almost perfectly, but that window closes quietly while patients ignore subtle signs. That's why people are shocked by diagnoses their bodies have been announcing for years. Now let me show you what that looks like in real life. Marcus was 34 when his hands started feeling strange. Not painful, not numb, just off, like they were wrapped in invisible gloves. His doctor said it was probably carpal tunnel. Marcus worked on a computer. It sounded reasonable. 6 months later, the sensation spread to his feet. Then came fatigue, bone-deep exhaustion sleep didn't fix. Then dizziness when standing, a racing heart, an odd inability to sweat. Each symptom felt too small to matter, and that's what made them lethal. 2 years after the first warning, Marcus collapsed at work. In the emergency room, a nurse ran a simple blood test. His blood sugar was 487. Normal is under 100. The nurse looked at him and said, "How are you even standing?" Marcus had type 1 diabetes, diagnosed years too late. His immune system had been quietly destroying insulin-producing cells. His body compensated brilliantly until it couldn't. The tingling, nerve damage from high blood sugar. The fatigue, cells starving for energy. The dizziness, autonomic nerve failure. The inability to sweat, more nerve damage. Every symptom was a warning, but they were subtle, gradual, easy to explain away. By the time Marcus was diagnosed, the nerve damage was permanent, damage that could have been prevented if someone had recognized the pattern earlier. His endocrinologist said something Marcus will never forget. "Your body warned you for years. We just didn't listen." So why does the body whisper instead of scream? Because your nervous system filters reality. You stop feeling your clothes, stop hearing background noise, stop noticing gradual change. This is sensory adaptation. Your body sends millions of signals every second. If your brain noticed all of them, you'd go insane. So it learns what's normal and ignores it. When damage happens slowly, your brain recalibrates. The abnormal becomes invisible. Then there's pain. Most people think pain is an early warning system. It isn't. Pain is a late-stage alarm. For many chronic conditions, your body avoids triggering pain until damage is advanced. Mild heart ischemia doesn't hurt. It feels like fatigue, anxiety, shortness of breath, or nothing at all. Hormones behave the same way. Your thyroid can fail for years. You gain weight, feel foggy, get tired. You assume it's age until a blood test shows severe dysfunction. By now, you might be thinking, these were rare cases. They weren't. They're the rule. Let me show you another one. Jennifer noticed she was using the bathroom more often, just a little. She felt thirstier, bought a water bottle, called it healthy. Her skin dried out. She bought better moisturizer. Her vision blurred slightly. She figured she needed glasses. Each change had a reasonable explanation. For 18 months, her body sent warnings. For 18 months, she explained them away. When tests were finally done, the results were devastating. Type 2 diabetes, advanced fatty liver disease, early kidney damage, retinal bleeding. Every organ system had been signaling distress. The frequent urination, flushing excess sugar. The thirst, dehydration. The blurry vision, swelling inside the eye. Her gastroenterologist said, by the time patients feel sick, the damage is often irreversible. Some of Jennifer's damage never healed. All preventable if the signals had been recognized earlier. This isn't about bad doctors. Appointments last 15 minutes. Symptoms overlap. Fatigue could be stress. Dizziness could be dehydration. Numbness could be posture. Without red flags, the most likely explanation is chosen. Medicine is designed to rule out emergencies, not hunt for whispers. But sometimes someone listens. David noticed mild breathlessness on stairs. Nothing dramatic. He assumed it was age. But his wife noticed something else. He was breathing hard just walking from the car to the house. She insisted he see a doctor. One question changed everything. When did this start? An echocardiogram revealed severe aortic stenosis. Once symptoms begin, average survival without surgery is 2 to 3 years. David caught it early. Surgery saved his life. His cardiologist said, "You listened. That's why you're alive." As you hear these, don't count how many apply to you. Ask how long you've been ignoring them. 1. Mild shortness of breath with normal activity. Heart disease, lung disease, anemia. 2. Persistent unexplained fatigue. Thyroid disorders, diabetes, cancer. 3. Tingling or numbness in hands or feet. Diabetes, vitamin B12 deficiency, nerve disease. People almost never have just one. 4. Changes in sleep patterns, sleep apnea, heart failure, kidney disease. 5. Unexplained weight or appetite changes, metabolic disorder, hormonal imbalance, cancer. Each is a whisper. Together, they tell a story. If you are following along, a subscribe and like would give motivation to continue the good work. A 2019 study following 10,000 patients found that those with persistent subtle symptoms were 3 times more likely to develop serious disease. 68% never received follow-up testing. Early heart disease detection reduces mortality by 40%. Pre-diabetes intervention prevents progression in 60% of cases. For many cancers, early detection means 90% survival instead of 20%. The science is clear. Here's the truth that changes everything. Serious disease almost never appears overnight. It builds quietly, and we're trained to ignore the signs, not to complain, not to overreact, not to waste time. So we silence our bodies, and that silence kills. The system treats emergencies. It doesn't catch whispers, so the responsibility is shared. Not panic, not fear, awareness. Pause for a moment. Scan your body. What have you been explaining away? Maybe it's nothing, but maybe it's a message. The tragedy isn't disease. The tragedy is missing the warning, because by the time whispers become screams, it's often too late. Your body is talking. The only question is, are you listening before it stops whispering?